Okay, Happy New Year and welcome everybody to our ninth series of the Medical Homa Therapy. Today we have again our key speakers, Professor Abel Hernandez. He's based in Peru now. The last month he was in Ecuador. And also we have Dr. Lennie Soo today. So this is our whole series. But wow, already come to the ninth series. Another two more. We actually make it a year already. Time flies. So this is again organized by I-Inspire. I-Inspire is an NGO, non-profit organizations that founded by Dr. Lennie Soo, and we are based in Malaysia here. So for those that if you like what we have been doing, so later you can like our social media. You can follow us so that you will know that what the next webinar that we'll be doing. For example, like past year in year 2023, for the 8th series of all the recording I have uploaded in our social media. So if you miss that, don't worry, just follow our social media. You can keep yourself updated, like how to perform, what is the dosage, how to do, if let's say special selected health condition that you are having, because we have discussed about 8 topics in the past. And here we are, I-Inspire. And if you like us, please want to follow our events, just follow our social media. And this is our topic for today. Today we are going to look into where we came from. Every human we came from the reproductive system, but as years go by, there are some illnesses, diseases might develop. So today we are going to talk about reproductive system diseases, and we have Professor Abel and Dr. Lennie Soo, who is based in Malaysia. So Dr. Lennie is a neurocounseling psychologist, clinical hypnotherapist, and a trainer on alternative medicine therapies. Her clinic is based in Bangsa South, Wisma Life Care Medical Center. And maybe I would invite Dr. Lennie to just share about her clinical experience, that what she came across, because I think her clinic also have a lot of reproductive cases where she applied, like, I think holistic healing for them. So Dr. Lennie, maybe you can share your experience before I invite Professor Abel.
I actually do not have as much experience as Dr. Abel when it comes to Homa therapy. I'm like everybody here. I'm also learning more and more each time about Homa therapy. But what I've been doing is I've been looking at, I've been encouraging my patients to do Homa therapy to see whether their mental health issues like depression and anxiety can be uplifted. I have found, because today, we are talking about our reproductive system. I find that when people when people practice Homa therapy, they become very, very much calmer, and hypnotherapy also seems to be able to improve their fertility by regulating their menstrual cycle. And another thing that I have noticed is that it does help to reduce the pain in cases of endometriosis, in cases of uterus cysts, in cases of fibroids, of fibromyalgia. These kind of problems that are related to the reproductive systems seems to be much better managed when they practice Homa therapy on a regular basis. And I know that a lot of my patients do not practice it regularly, but even though they don't practice it regularly, after they practice it, it seems that they are better able to manage their pain. It's not 100% that the pain is gone, but it seems that they are able to, Homa therapy is able to help them to manage things like dysmenorrhea. Dysmenorrhea is period pains, and right now I am focusing on dysmenorrhea in my clinic to help people who have very, very severe period pains to use Homa therapy, to take the ashes, and also to look at the biochemical content of their body from a neuro perspective, to look at their overall nervous system, to see how we can help them with the period pain. And we have some very, very surprising cases, really, really amazing cases, and where the lady can't even get out of bed because of dysmenorrhea. And then after that, Homa therapy and the treatment that we give it, she's able now to be quite okay with after 6 cycles of period. She hasn't really had the dysmenorrhea again, which is very, very surprising and also very interesting for researchers and scientists like myself. So on this note, this is what we have been dealing with now. I'm exploring dysmenorrhea, which is period pain. And period pain, as you know, is often related to fertility, is often related to reproductive system, is often correlated with toxicity and heavy metal in the body. So and I am seeing a lot of positive results. So maybe when I pass this back to Dr. Abel will show you some real cases, some testimonies of these people. I haven't been able to collect their testimonies because we're still in the middle of the research, but we will start to coagulate them, step by step. I have one patient here, Charlene, who is with us here today, and maybe she might want to share about her issues with with cysts and dysmenorrhea as well. But with that one, I can leave it up to her, whether she wants to or she doesn't. But on this note, I will pass it to Dr. Abel. Dr. Abel? Sorry, I'll pass it back to Hooi Lin. Sorry, Hooi Lin, your
Okay, no
call.
problem. Okay, thank you, Dr. Lennie. So, if sharing, if you are ready, you can let us know anytime because today is all about sharing. So, since Dr. Abel will be sharing all the cases from his side, so maybe you can share with us. But what I did notice is the heat, the warmness when we perform the Agnihotra does help, even like those that have very severe tetanus and the pain, and then it can help the warmness, the heat from there. So now let us invite our key speaker today, Professor Dr. Abel Hernandez. Dr. Abel, your turn now. Okay, so this is Dr. Abel. So he's based in Peru now, and he's traveling between Peru, Ecuador, and Colombia also. So past 3 months, you can see him. Sometimes he shared with us from Ecuador, sometimes from Colombia. So it's actually Southern America is where he based mainly now, and he built eco village, where they built the whole village is where everybody is like a retreat that everybody do perform and they get healed from that.
Now there is no echo. It's a great joy for us to share with everybody in Malaysia and other people who are with us. I can see there are some people from India and I think in South Africa and some other parts we can see there. When it comes to Homa therapy, I tell people don't believe anything. Maybe they made it up. Maybe they're paid for to talk about like this. Don't believe anything. Nowadays you cannot believe anything. But if you really want to know, try it out. Experiment for some time. And then please share whatever you experience. And where we usually hear is more amazing than we can imagine. So now I'll do my best because today we're going to show some videos that have been, they're not so familiar sometimes. This is Sofia in Esmeralda. She's from Ecuador connecting. I mean, you will see people joining. Let's share. Let's see what comes to my mind here. 1 second. These translations, I mean, this dubbing, these are very short videos, but let me tell you what is. This is a lady. She's a principal of several schools in Ecuador, and she's 40 something. and she have not have children. And but she, I mean, on her own, she do have many children in the different schools. And she learned about Homa Therapy. And she learned that Homa Therapy could help the children's understanding and IQ. So she said, let's put it to the test. My children do need it badly. So she started doing it with the children. And she participated teaching it. She saw the changes in the children, but the surprising thing is that for years she tried to have baby, be pregnant, and she could not. But something happened, and then she got pregnant, and that was a side effect of the practice that she was not expecting, but she was very happy about it because she already had lost her hope. Let's see how the dubbing came. It's a very brief one, but let's see how.
My name is Hilda Ronquillo
Mrs.
Miranda.
Hilda
Do I
Ronquillo.
thank you? I am 47 years old. I was telling the doctor that I was grateful for having invited me, Dr. Abel, that I have known him for some time, and that I wanted to share an experience that my father does not know. Maybe my mother does not know either, and I do not know
Yes, he
about
is my dad.
siblings. I was able to bring my aunt also, my brother also, who is in poor health. And I wanted to share two things. I did the therapy to improve the children's performance in school. At that time, I was the principal of 19 schools, and there were many problems with mathematics and language. And I did the therapy with the students. I only did 4 sessions because I lived 2 hours away from where I worked, and I came to see me there. I had to go back to Babahoyo, and then I had to rent a car. So I went back to Babahoyo 4 times in the afternoon, and those 4 sessions were done. Yes, it helped the children who did not like mathematics to get a little more love for mathematics, as well as the language students, and we exhibited that at the Science and Technology Fair. I did not get pregnant. Then, I was in a medical treatment that supposedly had nothing, that they were going to do some deep investigations. And in this process, to improve the performance of the children, my body improved. And I was able to get pregnant. And from that result, well, Valentina is mine, who is already 5 years old. How cute that! Who is because now of that situation, I was able to get pregnant based on the therapy. Of course, I did about 40 times the therapy, because I had to do it before. And that's when I did it.
I don't know if you can understand, but she went for it to help the children in the education, and because they were not so good in mathematics and so on. And she was the principal of 19 schools, so she had to do a different school. After 4 of the sessions, they had to do a science fair, and they did very well in the science fair, the students. But after more or less 40 times practicing with the people, with the children, she also got pregnant. And before that, she was under treatment, and they didn't know what to do. They could not. They said that that was not possible, her age and so on. Remember, her daughter at that time, she's 47, and her daughter at the time is 5 years old. So she was 42 then. Anyway, this is let's hear some questions first before we continue to the next one. Any comments? This is it. How often do you get something like this to happen? Okay. Anybody can raise if you have any question, any comment, reference to this case. We're gonna show something more. We're gonna show about some about cancer in the uterus. We have shown it before, but since we're talking about the reproductive system, and this was a terminal cancer. The next one, I feel inclined to share that again. This is Dr. Marvis from, the lady was talking, she was from Ecuador. And the next one will be from Venezuela. But again, I took on conceived my second child after Agnihotra. Indumati. Indumati. That's right. I was thinking about you. Did you hear? Did you see that? Everybody else, did you see the chat there? Indumati, she conceived her child after Agnihotra. A gift, another gift that came into the picture. Indumati, I believe she's in South Africa. Indumati, can you come into the picture? Is it possible? Or can you talk?
Sir, can you repeat? My connection went away. Sure, sir, I'll talk.
Could you, can you come in the picture, or can you talk and tell us a little bit about your case? Well, how long it was and how did you start it?
Hello, everybody. Like, so, after my son, so like, I started Agnihotra. For 3 years, we didn't want a child after my first child. Then after that, it had been 5 years. I had not conceived. I mean, nothing wrong. I mean, I had no issues with my health as such. Then I started Agnihotra. After Agnihotra, I got one period, and after that, I never got the next period. So in 40 days, I conceived.
Wonderful, wonderful. There are so many unbelievable cases. Indumati, we do talk on the phone before, right? We have talked about the phone before.
We have, sir.
Yes, I remember. Wonderful. I was thinking about you that maybe you could show up and you did. Thank you. Wonderful. That was a long time ago. Long time ago. Wonderful. Anyway, I'll tell you a story. Don't believe it. It happened many, 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 many years ago when I was barely starting with this. I was more than 20 years ago. And this is what happened. This happened in Colombia, in the Armenia. Armenia is the coffee area. Last time we connected from with Malaysia, we were in Armenia also. Anyway, we were doing Homa therapy in a farm. And a lady came and said, is this good for infertility? Can it help in cases of infertility? I said, well, let's try. I don't know. Let's put it to the test. But we have heard cases that people have been helped. Anyway, she just asked, and then we continue our process over there. Several months later, we were in another country and we're called, and she says, remember I did ask you about this for infertility problem. And when I asked you, I was not thinking about me because you already know me. I have children who are grown up and they were already in the university. I was not talking about me. I was talking about a friend of mine, and I didn't tell you, but you said that everything is possible. She didn't say who it was for her or for somebody else. She just mentioned it. And anyway, as I said, she have 2 children that were already in the university. And the surprise is that she got pregnant. And she said, well, this is good. And she said, well, the problem is the following. She said, they were already grown up and we weren't expecting more children. We were not needing more children. So I have the fallopian tubes cut and tied. So there was I was not expecting any children. That was out of the game. But after this, I got pregnant. The doctor who have that cut the fallopian tubes and they could not believe it themselves. But for some 12 years, more than 12 years, the fallopian tubes have been cut and tied. And anyway, now that she have a daughter called Sophia, and she's 20 years old. Okay, this is an eye opener for me. Anyway, I don't know if Dr. Lin have seen anything before like that. I have seen many things, but something like that where having cut and tied, and then a normal pregnancy, a normal development, no ectopic pregnancy, no, it was perfect development. So anyway, any other comments?
How was a woman did?
Okay. Otherwise, we'll go to the next sharing. Okay.
Marian asked how old is the woman and when she got pregnant.
After how long maybe?
We're talking about Indumati. We're talking about Indumati.
Yes, Indumat.
Aha. Indumati, please. They're asking, how old are you and when did you get pregnant?
Indumati,
Yes,
please
yes.
answer the question in chat.
Sure. Actually, I was around 29 years, and it was it was 5 years since I was wanting a second child. I was 29 years when I conceived.
29 years old. Okay. And you wanted a child. Okay.
And I had a normal pregnancy and a normal delivery. Everything normal.
Wow. Wonderful, wonderful.
Okay. Hello, Abel. I'm Marian Natalie from Colombia. We did some yoga and Homa Therapy in Tenjo. And I wanted to know if you remember also how old was the woman in Armenia when she got pregnant, because her childs were at university, so maybe she was.
Yeah, I believe she was 40 something. 40 something.
Okay.
Yes, remember the lady before the Hilda? She was 47 when she was given the testimony, but her child was already 5 years old, so she must have been 42 more or less when she had the delivery. So 40 plus. I know the lady that from Colombia, that one that was children university, that was 40 something. I can tell you what something is right now, but I know it's plus 40.
Okay, thank you very much.
Thank you, Marianne, and I'm happy to see you here.
Lo mismo. Bye bye.
Marianne, what you let me remember. You were with us in the elders home.
Yes, but my father calls me Natalie, so but I like Marianne.
Okay, thank you. It was a very joyful time. Everybody was happy. Thank you.
Thank you very much. I do it regularly now, and I help people also with problems.
Wonderful.
But I have
Marianne,
no. Tell me.
It is impossible for you to come into the picture, show there, because that lady people will be happy to see you. This is that lady. She's German, Colombia.
Yes, wait a second, please.
And she went to learn a little bit of Homa Therapy, and the same day she came to share with a group of elders in a retired home, and we were sharing the fires there with the people. Okay, let's see. Just trying to come into the picture.
Does it work? No. Okay.
No, you have to open there. Cheers.
Hello.
Okay, this is Marianne.
Yes, I have also testimony. It's nothing to do with fertility or so. So for another day, I can tell testimonies.
Okay. Remember, Marianne is going to share a testimony for another instant. Thank you, Marianne. Wonderful to see you. Give our regards to your parents, please. Your father and to your uncle.
Thank you very much for teaching us.
Wonderful.
Thank
I come to give a testimony. My name is Marbeth Hernandez Castro. I am 55 years old, and I had cancer in the year 1991. When I was diagnosed with terminal cancer, and the doctors said that due to the treatment I was going to receive, which was radiation and chemotherapy, my immune system was I was totally hopeless. The cancer I had was in the endometrium. I had extensive extensions or infiltrations, and the radiation I received was the maximum, and I received the beginning of chemotherapy, but my body could not bear it. Due to the severity, I had to perform an operation, a total stertomy, that is, complete, and then the organs were lost, the oval ones, you know as a doctor, well, other things. An operation, a total stertomy, that is, complete, and then the organs were lost, the oval ones, you know as a doctor, well, other things. The basal layer had to be cleaned, and the radiation treatment was quite strong. The doctor recently gave a certificate saying that the immune system, I have immunodeficiency, and I also present problems of uncontrolled anxiety. At that time, I was quite young. I was 41 to 42 years old. I had little time to live, and they were applying radiation because they talked about chemotherapy, which was very strong. So I began to ingest the ash, which is what is produced when the organic substances in the wine are burned with the coast of cow. And that relieved me not only internally, the part where I had placed the part that marked me with the radiation. There, it feels like a very strong sunburn. So the chamomile helps, but it didn't calm me down. So I put talcum powder from the ash dust in the area. And then I saw that my body began to recover. On that occasion, the tests were done on other patients who received the same treatment and had less cancer, that is, milder than the same one. And at that time, in the year 91, these people's cancer could not be controlled, and they all died. They asked what was being done, and then I told the doctor, Dr. Victor Taborda from the Avila Clinic, that I was practicing a fire. Then the complainant said something else. During the period that I was sick, and during the entire radiation without stopping consecutively, I managed to restore my immune system. So I get fewer crises than the ones I told you about, and I stay well. And my body reacts in a beneficial way because we practice Agnihotra, which is the output of the heart. But this is an Ayurvedic science that has a method, a verification, but through your own experience like me, you know that there is a hope. And that hope is the oldest medical science and vinyls, such as the science of Ayurveda, of Homa Therapy, that they do not believe what one tells them. Nowadays, doctors are amazed when they see me because I always say, well, look, it seems like it wasn't my turn, they tell me, although you received some help not only from a medical point of view, but you also received some other type of help. However, now when doctors see me, they tell me I am totally healthy. My name is Marbeth Hernandez Castro. I am 55 years old. As I already said, I was born in Caracas, and my address is Organización Bella Vista, Calle Cuarta con Quinta Avenida, El Parque Sector, Calle. Blind. House number 8, Quinta Colamodo. My phone number is 212-471-4564. I am completely at your disposal to provide you with any information, and I am Catholic.
Okay. That was the audio. I wanted to check also the video, but in Zoom, there are two different files. There are two different files, so I don't know how to open two files at the same time. I know there is a trick on Zoom to open two files different files at the same time, but maybe you can tell me. However, the sound was okay, no? Okay.
Yes, the sound was great.
Yes.
Very
so
good.
was terminal cancer. She was hopeless. And they did the radiation, they did the chemo, and they have done some hysterectomy also. And she was sent to prepare her will, to say goodbye. Surprise, she recovered completely. There was 41 between when she was 41, 42, and now she was 55 when she was giving the testimony, and she looked beautiful. Let's see if I can share her video. Her video has some subtitles, but you will see her. Let me see. Yeah, 1 second. Let me see. There's no. I see what happened. Okay. See with some subtitles. Can you see there?
Yes. Then.
Yes.
Vengo a dar un testimonio. Mi nombre es Marbéis Hernandez
So my name is Mario Hernandez Castro. I am 55 years old.
Castro. Tengo 55 años. Tuve cáncer en el año 1991. Cuando me lo diagnosticaron, era un cáncer terminal y los médicos dijeron que debido al tratamiento que iba a recibir, que era radiación y quimioterapia, mi sistema inmune iba a presentar bastante debilidad.
Can everybody see the subtitles?
Estaba
I was completely hopeless.
totalmente desahuciada. Entonces, el cáncer que presenté fue en el endometrio.
Cancer was in the endometrium. And he had intensive filtrations.
Que tenía extensiones o infiltraciones extensas y la radiación que recibí fue la máxima y recibí en principio quimioterapia, pero no la soportó mi organismo. Debido a la gravedad tuve que realizaron una operación.
They do radiation, chemotherapy, and then a total hysterectomy.
Una histerectomía total, o sea, completa, y entonces ahí se perdieron pues los órganos, los ovarios, usted sabe como médico pues otras cosas. Hubo que hacer limpieza de la capa basal y produjeron el tratamiento de radiación bastante fuerte.
Even though the video quality, the resolution is very low, because it was many years ago, you still can see a beautiful lady in front of you.
El médico últimamente extendió un certificado donde dice que el sistema inmune, tengo inmunodeficiencia y presento también problemas de angustia no controlada. En ese entonces estaba bastante joven, tenía 41.
There, she said, at that time she was between 41 to 42.
42 años. Me daba poco tiempo.
That means when she had the cancer. Now she's 55, but 41, 42 was when she was diagnosed with cancer.
Tiempo de vida y la radiación pues que me estaban aplicando, porque pararon la quimioterapia, era muy fuerte, entonces yo empecé a ingerir la ceniza, que es la que se produce cuando se queman las sustancias orgánicas del hijo en la posta de vaca, y eso me aliviaba no solamente internamente, la parte donde tenía colocada la parte que me marcaba con la radiación, ahí se pone eso como un quemado de sol, bien fuerte. Entonces la manzanilla ayuda, pero no me calmaba. Entonces me ponía talco del polvo de la ceniza del Agnihotra. Y luego vi que mi organismo comenzó pues, a recuperarse. En esa oportunidad se hicieron los exámenes a otras pacientes que recibieron el mismo tratamiento y tenían el cáncer más leve que el mío. Y en ese entonces, en el año 91, el cáncer de esas personas pues no lo pudieron controlar y ellas murieron todas. Preguntaron qué se estaba haciendo y entonces yo le comenté al médico, al doctor Víctor Taborda de la Clínica El Ávila, que yo estaba practicando un fuego, entonces la que es el Agnihotra, durante el periodo en que estuve enferma y durante toda la radiación sin parar consecutivamente, yo logré restablecer mi sistema inmune. Entonces me dan menos crisis de las que le hablé y me mantengo pues en armonía y de mi cuerpo reacciona de una manera beneficiosa porque practicamos el Agnihotra, que es a la salida por el sol. Pero esto es una ciencia ayurvédica que tiene un método, una comprobación, sino que a través de su propia vivencia como yo, sepan que hay una esperanza y que esa esperanza es la ciencia védica más antigua y milenaria, como es la ciencia de la ayurveda, de la terapia Homa, que no crean lo que uno les dice, que hoy en día los médicos se admiran cuando me ven, porque yo digo siempre, bueno, fíjense, parece que no me tocaba, me dicen, no, que alguna ayuda recibiste, no solamente desde el punto de vista médico, sino que algún tipo de ayuda más recibiste. En cambio ahora los médicos cuando me ven me dicen, yo estoy totalmente sanada. Mi nombre es Marbella.
Now the doctor tells she's completely healthy. And in 1981, when she was diagnosed with this terminal cancer, in that place, which was only dedicated to oncological cases, this hospital, the patients of that year, all of them have died, but something happened with her. Even cases where which had the cancer was not so severe, they still died. Anyway, let's share that microphones. Time for questions and comments. Okay. Chris Alexi. Okay. You see, Mother Sofia, you can see the lady doing the fire in front. She's in Ecuador doing the fires there.
Oh, Sophia, yeah.
Chances are she's doing Triambakam Oma.
Yeah. Hi, Sophia.
Okay. Okay. Any other question or any comments? Otherwise, we'll share more cases. Okay, Mrs. Hui.
Yes.
How can I open two windows at the same time in Zoom? I have these two windows that I want to open. I know
I think you can only share one window, if not mistaken.
No. Two of them can be open. I just don't remember the trick because that was a long time ago I did it, but I have, but then we have to.
Is it go to the advanced? You share the basic. Normally we go is the basic, right? Then the tab next to the basic is the advanced. But you have to crop as a second screen.
Which screen you're talking about? Let me see.
The top, the tab there, when you share screen, you can see basic, and then next to basic is advanced.
Yes.
I think the advanced is the part that portion of the screen, which part that you want to share, or content from second camera.
No, it's video and that is a trick where you can open both at the same time, but I don't remember now. I was hoping you would let us know, but anyway. I wonder if anybody in the group knows. Let's see, I have anybody, Chris, into Martin and Marianne. And I don't think so. Let's open that then. Unless you go into Google right away and check it out, how to open two windows at the same time in Zoom. That is a trick there. I know that is a trick. This says to you the. Let's see.
What do you mean by looks good? Saw his beard. Maybe some 90 years. Oh, more than 85 years. He'll be 85 to 90. See his eyes and all. So healthy he looks. I don't want to find. Oh, okay. Best in a missing.
You've mentioned to me that quite a number of years back, prior to your introduction to Homa Therapy, you experienced a significant health issue.
Yes, doctor.
Very good. You have been coming to the Reproductive hospital, correct?
Yes, I've been coming.
Tell me your problem before you came.
Before coming, doctor, I had a 3-month hemorrhage.
A 3-month hemorrhage.
But I went to Lima, and in Lima they did radiotherapy, but I still didn't have the bleeding.
In Lima, they gave me radiation, but it continued. How many radiation treatments?
16 sessions. I had a left side as big as an orange.
Left-sided tumor, roughly orange-sized.
It disappeared from me.
Where might that be located? Could it possibly be within a specific organ? To be more precise, on the left side, situated within the ovary.
In the ovary?
Yes, ovarian.
Aha, my uterus was also being compromised, and that was causing me to hemorrhage.
Her womb was affected, leading to bleeding.
Thus, I began to make my way to this place indeed, and I made it a point to come here each and every day.
How did they do surgery?
No surgery. The doctor said it had been a miracle that the tumor had disappeared. But I was coming here.
You were coming here and you were taking the Agnihotra ash?
Yes, yes.
For what length of time were you engaged in that activity?
I always continue to take the ashes.
How long did you do it until it was cured? How long did it take to heal?
1 month.
After a month, did the bleeding stop?
Yes, the bleeding stopped.
Very good. And then did they do other tests to see what happened to the tumor?
Now I go to my checkup because my son wants me to go. He doesn't want me to do it here, but there for my checkup. The doctor finds me healthy. He tells me that I was in the 3rd degree of cancer.
Was it a 3rd-degree cancer?
Yes, almost the last grade.
Almost to the last grade. With this Homa Therapy, it was healed.
I thank you for the therapy that you share, doctor, and to all the volunteers and followers, to Dr. Antonio Manuel, to the engineer Manuel Trellis.
Very good.
I thank them because they practically have cured me with the favor of God.
Okay, so you are completely healthy, and that happened 10 years ago.
Yes, doctor. And after the radiation therapy, my belly turned all black, completely black. I had the idea of putting Agnihotra ashes on my belly. So 2 days later, I saw myself, and my belly was clear. It was okay. That black thing about the burning out therapy disappeared.
Ah, with the radiation treatment. What did they do in Lima? All that black was a burn.
The skin remains black like when the iron burns.
How the iron burns.
So I'm going to put ashes on my belly. I laid down, and 2 days later, that black thing disappeared.
2 days after putting on the healing ashes? Only the ash or ash with ghee?
The ash alone.
Just the ash?
Yes, only the ashes.
And after 2 days?
That black thing disappeared.
That disappeared.
With this Homa Therapy.
Does this therapy work?
With Homa Therapy, I feel like an electricity passes through me here.
A current? An electricity throughout the body?
Yeah.
Since the first time?
Yeah.
Did you feel it today too?
Yes, doctor, what I have never told you.
Have you ever mentioned this to anyone?
Yes, later, doctor. Excuse me, I have a cousin who has breast cancer. I send the little ash that you gave me. I really send her a little ash. She said that she is better.
I was sending the ashes to a niece who has breast cancer in Canto Grande. Where is Canto Grande? In Piura or?
No, in Lima.
In Lima.
Uh-huh.
And has that helped her?
Yes, it has helped her a lot. She no longer feels much pain and sleeps peacefully.
Mother, we want to thank you very much. Give him a round of applause, please.
That is really amazing, Dr. Abel.
Yes, it's
That's a really amazing testimony.
it is amazing. I'm telling you, you will. Usted me dice que tenía un problema de salud hace muchos años antes de venir a la terapia Homa.
Sí, doctor.
Muy bien, usted ha estado veniendo al hospital Reproductive, ¿correcto?
Y acá está viniendo.
Cuenta su problema antes de venir.
Y antes de venir,
She was
doctor,
bleeding
tuvo
for
una
3 months.
hemorragia
This
de
is the one
3
you know
meses.
before. Now I'm showing you the picture. It's a little dark there because it is in the hospital and it's after we finish and still a little dark there. Una hemorragia de 3 meses. She went to Lima. Lima is the capital of Peru. We are in Piura, north. We are 1,000 kilometers away. But she, for that kind of treatment, more heavy specialized treatment, she had to go to Lima. She was 3 months bleeding, and then she goes to Lima. So they did
radioterapia.
treatment of radiation.
Y aún así seguía yo con el sangrado.
En Lima le hicieron radiación y así continúa sangrado.
Radiation treatment, but the bleeding continues.
¿Y cuántos?
16. Yo tenía
16.
Tenía un tumor al
So on the
lado
left
izquierdo del
side,
tamaño de una naranja.
she have a tumor on the size of an orange, she says. It was in the ovary on the left side.
Un tumor al lado izquierdo, al lado del tamaño de una naranja.
Se me desapareció.
¿En qué parte? ¿En algún órgano? En el ovario. Ajá.
And it was also affecting the uterus, and that's why he has so much bleeding. You can see this is an older lady. She's an older lady. And when you have an old person, sometimes usually they have high blood pressure and other problems, and you don't want to put somebody here on the surgical table right away because you might lose it right there. And with all this probably spreading because it wasn't the ovary, but already in the uterus. Anyway, she was there 3 months, bleeding, she came back.
Entonces comencé
Then
a
she was
venir
coming to the
acá,
hospital
sí,
here
pero
in
venía
Piura
todos
every day and take a dash every day. Now remember, she's given this testimony
días.
10 years after that. Okay, that happened 10 years ago.
¿Llegaron a hacer
They
cirugía?
did not
Nada
get
de
to do the
cirugía. El
surgery.
doctor dijo que
The
había
doctor
sido
said
un
this is a
milagro que me
miracle
había
how that
desaparecido.
disappeared. They don't understand how can it have disappeared. But she was coming there.
Entonces,
Yo estaba
And
viniendo acá.
up to that time,
viniendo acá,
she's
y
taking
usted
the Agnihotra every day. Agnihotra ash.
estuvo tomando la ceniza de Agnihotra.
También.
¿Por cuánto tiempo estuvo haciendo eso?
Yo sigo tomando siempre.
Ajá, pero ¿a cuánto tiempo lo estuvo haciendo hasta que se curara? ¿Cuánto tiempo pasó para curarse?
After 1
Después de
month
un mes
of
paró la
doing
hemorragia.
Agnihotra and taking the ash, the bleeding stopped.
Muy bien. ¿Y después le llegaron a hacer otros exámenes para ver qué pasó con el tumor?
Ahora yo voy a mi control porque mi hijo quiere que vaya, no quiere que vaya acá a otro hospital, sino allá a mi control.
Ajá.
Pero el doctor me encuentra sana, me dice que yo estaba en el tercer grado de cáncer.
It was the 3rd-degree cancer, almost 4th, but something happened that she's okay.
Tercer grado de cáncer.
Sí, ya casi el último grado.
Ya
Pero
casi el
con
último
esto
grado.
me sané.
Con esto se sanó.
Le doy gracias a la terapia que y a usted, doctor, y a todos los seguidores, al doctor, al señor
She's thanking all the
Manuel,
followers and
Angelo
volunteers
Manuel Reyes.
that go to the hospital to teach this and share with the people every day at that time.
se murió antes.
Muy bien.
Le doy gracias porque ellos prácticamente con el favor de Dios me han curado.
Muy bien. Entonces, usted está completamente
that
sana
happened
y eso
10 years
ocurrió hace
ago.
10 años.
Sí,
She's
doctor.
healthy.
Wow.
Y después de la terapia
She said
se
after
me
the
puso mi
radiation
vientre
therapy,
todo negro,
her
negro.
abdomen was black with so much radiation that the skin was black.
Por completo.
And it came to
Se
her
me dio
mind
la
that
idea de
maybe
echarme
we could try
ceniza
to
en
apply the ash because she had found that she heard it was good. So she decided to put it on.
el vientre.
Ajá.
Entonces a los 2 días me veo,
then
mi
after
vientre
2
está
days,
igual como lo tenía antes.
The skin color or the abdomen was normal. All this
Desapareció
burn,
esos
black
negros
spots from
desde
the
que quemaba la
radiation
terapia.
have disappeared.
Con el tratamiento de radiación que le hicieron en
quema
Lima,
eso,
se quema todo eso
se queda
negro.
la piel negra como cuando se quema la plancha.
Como se quema la plancha.
Entonces yo voy a echarme ceniza en mi vientre, me eché y a los 2 días se me desapareció eso negro.
A los 2 días de ponerse la ceniza, solamente
she
la
even
ceniza
put
o ceniza
only,
con
I
ghee.
asked her if she had placed ghee and ash. He said, no, I just put the ash, only the ash. And even then, still, after 2 days, it was gone, that burn. Anyway, I just, it's no dub here. You heard the dubbing before, but it was the dubbing with artificial intelligence. So now I playing the real one in Spanish and doing a little translation for you. But okay, questions coming. You can see this is helping the Jan, the not so Jan, and the little ones. Okay, little one because the one when the mother gets pregnant and the development is totally well. Even we have cases of people who manage to get pregnant with a lot of difficulties and a lot of these fertility treatments and all that, but it was such a difficult case that they will lose the baby during the delivery. There were some these cases, and this is very heartbreaking for the people when they go through the experience. But with Homa Therapy, the gestation, there was the conception and the development and the delivery, everything perfect. So what do you have to lose? You can try it if you have cases like that. But it's also for other type of problems, like we say, myomas, or fibroid tumors, or all these cysts and so on, but also in men with a prostate. Usually when it comes to reproductive, I think the women are the queens. Men are you don't hear much about it. Like you say, like Dr. Lin say, men are kind of shy talking about these things. Anyway, any other comments or questions?
Marian have a question, Dr. Abel. How do you put the ash on the skin without ghee? I think
This is interesting. They just spread it. They spread it over the skin. They put it over there and cover it up with a little something wrapping around, and they leave it like that. I usually recommend it with ghee because with the ghee they will stick to the skin, no? And it penetrates faster. But people in their search for relief, whatever they see, they do in the experiment and they tell us. So remember the first doctor, Dr. Marvis, the one that was with the cancer also, and she also had burned skin, and she said she was using chamomile. Chamomile is a plant, so she put that and find some relief, but it will not completely. But with the Agnihotra powder, just the powder, it disappeared and got well. That was the case I heard from her many, many years ago. But then this lady also, the same thing, just put in the ash, but I usually recommend it with the ghee because the ash it goes everywhere. Okay,
it is so amazing that even without the ghee, the ash is still very powerful as a medicine.
Yes, it is. Marianne, I think Marianne wants to say something. I think Marianne, I don't know if she's raising the hand.
Okay, yes.
Yes, Marianne.
Now I was traveling 15 days through Colombia, and you cannot get the ghee, and I was asking myself if you can also mix it with water to put it in the skin.
Yes, you can mix it with the water if put it on the skin. If you don't put it with ghee, it's okay. But as you see, even put it directly, some cases they get an effect. But you can do also some vegetable oil, like olive oil or coconut oil. Coconut oil might be better. Okay, if you cannot find ghee, coconut oil will be good.
Thank you.
I think in Malaysia we have a lot of coconut, no?
Yeah. We do have.
Okay.
We are not the major producer. I think the major producer is Indonesia and Philippines.
Okay, but
yeah, but it's really about the pricing.
I just remember the jackfruit. Jackfruit is
Oh yeah, the jackfruit.
well, jackfruit. They put it okay. Okay. Well, let's see what else. 1 second. Let's see what I find over here. Okay. This is interesting. This is in the state hospital. This happened in the state hospital. She is the wife of a friend who practices Homa Therapy. He's a therapist himself. And his wife, she has some issues of fertility. And anyway, she decided to put it into the test. Now, remember, this is AI, artificial intelligence. Sometimes there is intelligence not so intelligent, but let's see what happens. How it comes out. Can you see here?
Yes. And
Fertility and depression.
My name is Judith Arce Lopez. I am 35 years old. About 2 years ago, they told me I could not get pregnant. I went through hundreds of exams in different hospitals, clinics. I spent everything I earned on tests. They told me that they did 3 arteriographies on me, which are very painful exams to see if the tubes they were built or not. But really, no, everyone agreed with the same. They said no, that I couldn't, that the insemination had to be 6 meters, yes or yes, so that they wanted to coincide.
Oh, it got cut off there. 1 second, let me see. This translation like that, they do it very briefly. They do it for 1 second. Judy Lopez.
About 2 years ago, I was told that I couldn't get pregnant. I went through hundreds of exams in different hospitals, clinics. I spent everything I earned on exams. They told me that they did 3 hysterical alphibographs, which are very painful tests, to see if the tubes were blocked or not. But really, no. They all agreed with the same thing. They said no, it couldn't. That insemination had to be done in vitro, yes or yes, so that I wanted to get that hair. Well, which I already saw as impossible. The problem was that I had a polyp in the endometrium mainly, and they told me that the tubes were completely blocked. That the only way I could get pregnant was through insemination, which had a cost here. And there were different centers, different hospitals, clinics, and they all told me the same thing. They told me that I could have children through the insemination, and the cost was $5,000, which for the economy is very high, right? So in that process, they operated on me, and from there they told me that, well, already disappointed, I became too depressed, and then I met my partner. He taught me what Homa Therapy is. He took me, I even went to Piura, and he went to look at me flowers, also on several occasions.
They operate on her, but nothing happens. Anyway, she got into Homa Therapy, and let's see it.
And from one moment to the next, I became pregnant. In which I couldn't believe. I said, but it's not possible. I didn't believe. They did my biography. They told me, no, it is not possible for me to get pregnant because they have already told me they have done the tests. I never took care of myself. Through practicing Homa Therapy, I add to that because when I got pregnant, I still didn't believe it. In my first biography, they told me that when they told me I was pregnant, I said, no, that's impossible. Then he told me, well then, miracles exist because you are a month and a half pregnant, but it is high risk. So when they told me that, I went to another clinic and they did another ultrasound, and again they told me that yes, I was indeed pregnant, and that there was no margin for error, and that the pregnancy was continuing, and that there was a threat of miscarriage, right? That I had to take good care of myself. The first 3 months I took care of myself. I took good care of myself. But I already made my life normal. I even played volleyball and never lost the baby. In other words, I never suffered from a urinary infection like most mothers have. My pregnancy was losing him. So yes, when I went there as the time to give birth approached, they told me that it was likely that they would do a cesarean section because I was constantly monitoring to see that everything was going well, but for only 1 hour I suffered. They induced me to the ship, not because my water broke without suffering any pain or anything like that, and when they induced labor, for an hour I suffered from foot pain and diagnoses. Calm, natural birth. Gastro-real. In the end, he thanked her from one moment to the next, without any treatment, without anything. Only through the therapy that I let go. And now I am the happiest woman in the world. You can tell my 35 years. I am the mother of this beautiful woman. I say that's the only miracle, right? The one that gives my soul to see that I have been able to get pregnant. Now I'm happy. I still don't believe it that I have my baby. Also, another thing I could see is that my father died in an accident. And the truth is that my mother became very depressed. My mom is 74 years old. She was crying too much and there was no way to calm her down. You were on antidepressant painkillers, right? So, but my partner, who constantly practices therapy, told me, let's hit the ashes. So, I started giving my mom a vacuum with water to the battery. So, I started giving and giving. More or less, over the course of a week to 2 weeks, it started to consume the ash, right? Then, he began to stop using it. He began to accept that my dad is gone, that he left us after, well, she had to say that my dad had 54 years of marriage, a happy marriage. And my mother, through consuming the ashes, is what she began to feel good. She began to accept that my father was gone. And now she hasn't stopped taking the antidepressants. She doesn't take it anymore. She doesn't take it anymore. So now she is the one who gives us the strength to accept that my dad is here. Those are really the experiences that I have been able to see from therapy. Fantastic. And right now you are practicing together, right? Yes. I have also seen that you practice and have your pyramid. Now I have my pyramid. I practice it, right? Okay. Fantastic. Not very often.
You can see this AI still a little bit, some fine tuning or some more tuning is needed there. But you get the idea. Lady, she spent they spend a lot of money on testing and thousands, hundreds of tests and 35. Anyway, she could not believe it that she really have a chance because they have told her they had to be the fallopian tubes were clogged and that there was problems with the endometrium that she have some formation there that and so on. Anyway, she did naturally get conceived and she have a normal delivery. Everything was perfect, and it's a beautiful baby. I don't know if you could see the picture on the baby on the side. It's just a beautiful little girl. Anyway, I think it's time for questions and answers to be closing. And okay, the microphones are open for comments and questions. That's just another.
But the thing is that she did get pregnant, and she did get pregnant naturally also.
And without going through any surgery. Normally, the doctor would recommend keyhole surgery. This is really
yeah. So that's an incredible story.
And the development, everything was normal. They tell you it was high risk, there was no risk. Development normal, just everything, and then they're supposed to cesarean. No, it was natural birth. I mean, this is like what? Like
I know,
people were there. Where are you making this up? This is this is
and she's so nice to share the story as well. So it gave people hope because there are so many women and men out there that that are experiencing infertility, and this can give them hope.
Helpless, yeah. After IVF, they still feel helpless, then they cannot get it. Okay.
Yes.
Okay, so we're going to be ending the session soon. If there's no more questions, Hooi Lin, I
Yes.
pass it to you. Yeah. So
Okay.
anything else we need to tell the thing about the next upcoming events?
Yes. Let me make announcement. In between, if you have any question, then you can just
Miss,
in your question. Okay.
Miss Sui,
Yes.
let me just show you the lady, the picture of the lady, the video. You already heard the sound, so just show it so you see the lady, okay?
Today you have all the pretty ladies.
The image also speak, you know, it's not just the sound. Look at her. It's gonna be in Spanish, but look at her anyway.
Today all your cases, ladies, very pretty.
There is Judith Arce Lopez. You can see that, no? This is in the hospital, Bay Hospital. Hospital, you see, University Hospital. This is in Lima.
Mi nombre es Judith Arce López, tengo 35 años. Hace aproximadamente
35 years old
años
now,
atrás
but almost 3 years ago, she had that problem, and she could not have pregnancy.
yo no podía quedar embarazada.
Hundreds of
Yo pasé
tests,
por cientos de exámenes
hundreds of tests and treatments,
diferentes
and
hospitales,
nothing would work.
clínicas, gastaba todo lo que ganaba, yo gastaba en exámenes. Me decían que me hicieron 3
And then there's all these
histerosalpingografias, que son
examples,
exámenes
painful
muy
and so
dolorosos.
on. I'm just going to show you that lady's face and the child. I hope I want to see. I like to see the child. 1 second, vamos a ver. There is a little bit on the left side, a little bit.
Oh yeah.
There, you see that one is there. You can see this beautiful.
Yeah.
And very
young
healthy.
lady there. Yeah, look at those eyes shining and the skin and all that.
She's so healthy. Awesome.
Yes. She is beautiful. Anyway,
Our Agnihotra baby.
Agnihotra baby, definitely. Agnihotra miracle baby.
Yes.
Anyway, now I let Mrs. Sui prepare the closing. Thank you everybody for this great opportunity.
Okay, thank you everybody for joining us today. So our next series will be in February. So actually supposed to be on the 9th of February, but because it's clashing with Chinese New Year. So we know that everybody is busy for Chinese New Year. Have you seen any Chinese New Year celebration? Dr. Abel, have you seen any Chinese New Year celebration?
No, I have not seen it. No.
It's like actually a new year for all the Chinese, I think, worldwide. So it's like a new year celebration. So most of the people will be not around in the town. Will be going back to the hometown for reunion and all these things. So there is a reason why we will postpone 1 week. So instead of the second week of the Friday, we will move it to the third week. So this is the only month that is not the webinar is not falling on the second week. So we'll be on the 16th, 2 days after Valentine's Day. It will be easier to remember. So we will be moving to 16th of February. So the time we will talk about some muscular system problem, mainly about pain and gout, and I think carpal tunnel, because of all the PC usage, a lot of people have these issues lately also. So I think it's good that we look into this. Since it's New Year, after New Year, everybody back from holiday have to start work. Okay, so this is our contact. If you want to be one of the members, I think just now in the chat, I think May have shared some also. And then I have shared all the past series, all the YouTube link. If you miss our past 8 series, for today's series, I will upload in our social media when it's ready in YouTube as well. So if you want to get in touch with us, you want to know the application or other issues that you want us to maybe inform or invite Dr. Abel to share, you can message us in our social media as well. We will try our best.
Also,
Okay.
if they want to give testimonies.
Yes, you want to share any of your real life experience and how long you have been practicing, and then what are the changes that you experience, and then you can please just go to our Facebook, Persatuan I-Inspire, and just leave your message there. Or if you would like have any topics or any theme that you would like maybe to hear the application of Homa Therapy, you can let us know also. Then we will pass a message to Dr. Abel. Yeah, then we will try our best. Yeah, that is what we try to do throughout until I think our last series will be in October this year. Okay. Thank you everybody for coming. And before we end, group photo. Can we take just a simple group photo? Everybody can turn on your camera, please. Fast one, and just smile. It's New Year. Just one, just one.
And Maria. Thanks, everyone. Thank you, Sophia. Thank you, Maria. Thank you, Chris. And definitely, Dr. Lin and Mrs. Hui. And May.
Thank you so much, Dr. Abel. I mean, always a pleasure to have you on board. So thank you so much, and let's do more and help more people in this 2024. Thank you so much.
Thank you.